Hi, and welcome back to the Ask Dr. Renee show here at blackdoctor.org. So today I'm so excited. I get to share with you Dr. Rader. Dr. Rader is going to talk to us all about hypertension, which, as we know, is something that affects a lot of the people that are watching this show right now. So I want you to do as you always do, share the broadcast. Let us know where you're watching from. If you have questions, type them in the chat. And let's get started. Dr. Rader, thank you so much for joining us this evening. Please tell us exactly what it is you do at Cedars-Sinai.
Yeah, hi, Dr. Renee. Thanks so much for having me on your podcast. So I am the medical director of the Hypertension Center of Excellence here at Cedars-Sinai. And what I do is I see patients with very difficult hypertension. So patients who are just having a hard time and struggling getting their blood pressure under control. And maybe we can discuss a little bit today, what does that mean, having your blood pressure under control?
So first I have to say something. You have a lovely heart on the table back there. Everyone, that's the way your actual heart looks like in your chest. It is not shaped like, what does everyone does this? Yeah. It's not shaped like this. It actually is shaped like that back there on the table. But so hypertension, for anyone that doesn't know, means simply high blood pressure, correct?
That's right, yeah. And there are different guidelines. We in the US just got a new set of guidelines in 2017. So now almost 7 years ago or so, but it's still, I think the old guidelines are still stuck in a lot of doctors and practitioners' minds, where a blood pressure of 140/90 was the definition of high blood pressure. Now we lowered the bar to 130/80. So
Okay,
now,
I didn't realize it was 140/90. I'm sorry to cut you off.
well, I'm really glad you're not aware of that, but in the community, it's still sort of out there, the 140/90. So 130/80 is the new goal, and we should all strive to reach that goal.
So, people do not believe, but anybody could be walking this earth and doing all sorts of things and have high blood pressure, couldn't they?
Yeah, unfortunately. So especially as we get older, blood pressure has a clear upward trajectory, and very few of us can escape that trajectory. And there's certain groups that unfortunately have even a steeper curve of blood pressure increasing as we get older. And the Black community is one of this group that just has more severe hypertension early on in life and more severe as we get older.
So, when I say that, people they don't realize they're walking around with high blood pressure. This is why it is so important. How often should we check our blood pressures?
That's difficult. So I don't want anyone to become obsessive about it,
Right.
worry about blood pressure all the time. But I think so you should see your doctor at least once a year, and then they will check the blood pressure. And hopefully they will do it right and see, make sure it's not white coat hypertension they're treating, just being a little bit nervous in the office, but really repeating measurements and getting a stable assessment of your blood pressure. And once you have that, then you can tell, oh, is my blood pressure a little bit too high? Or is it where you want it to be? And if it's too high, then you have to measure a little bit more often. So I would say get a blood pressure cuff, check your blood pressure at least once a month to check in where you're at. Always check your blood pressure a little bit more frequently after they change your blood pressure medications to make sure they actually work or they're not lowering blood pressure too much. So it really depends. But I think a good rule of thumb is check into your blood pressure once a month or so.
Yeah, so white coat hypertension, for those that have never heard the term, is when your blood pressure just tends to go higher when you see somebody in a white coat, presumably, obviously the doctor. Some people's blood pressure is just higher in the doctor's office than it is at home.
That's right.
Which is why you should probably check it a couple times at home and record it. Because you checking it and not knowing the number to tell the doctor is not going to help you get rid of your medication.
That's right. Write down those numbers, bring them to the doctor visit, and it's so helpful for your doctor to see if the treatment is actually working or if the treatment needs to be changed.
And also put the time and the date you took it so that they know. Also, if you are taking medicine, put that information too, so they know, okay, you took your medicine and then this was your blood pressure, or you took it and then your blood pressure after, whatever. So please, and the best thing to do is everyone seems to be carrying around a phone. Put it in your phone in the note section, because I bet you'll have your phone with you at the office visit, but you might forget the notebook. But you'll have the phone. So make sure you do that. And then, so white coat, like I said, white coat hypertension, some people have, some people don't. Also, blood pressure monitors are not expensive. You can even get them on Amazon.
Yeah.
You don't have to pay $40, $50. You can get a $20 one or less, and it will do the trick. The more expensive ones, of course, they do record the information for you. They have apps available on the phone so that information is properly stored in there. So then you don't have to even write it down. It's going to keep it in there. But really, it's not expensive to buy a blood pressure monitor. And they come with the directions to show you how to properly take your blood pressure, because that is also key. Because if you take it with the wrong size cuff or incorrectly, you will have all sorts of wrong diagnoses. True story, I was at the doctor and a new MA, I think it was, did my blood pressure. And I tried to tell her I needed a different cuff, and she just refused to listen to me. And so she did this.
Your patient.
And I think, and I think she didn't pay attention to that, because most of the people knew that I was a doctor in there, but she didn't pay attention or whatever. So she took that blood pressure and she told me what it was. And I was like, that is way off. And so I went into the office, and I'm sitting there waiting for the doctor to come in. The doctor is literally about to write me a prescription for blood pressure medication and was like, Renee, what has happened? And I said, now, mind you, I had lost like 30 pounds since my last visit. So how do you lose weight and then all of a sudden your blood pressure has went through the roof? So she said, Renee, and I go, stop right there. I said, please retake my blood pressure, because she didn't do it right. And she did, and she goes, oh, I got nervous. I was like,
it is so important. It is so important. So, and it's really interesting. If you use too big of a cuff, you will underestimate the blood pressure, so it'll just measure too low. But if you use a cuff that's really tight and too small, blood pressure will be way too high. And there's some other things you should remember. You should sit there for a couple of minutes, right? You should not have to go to the bathroom. So go to the bathroom before you see your doctor or have your blood pressure checked. Uncross your legs. Make sure your back is supported. All these little things add a few millimeters of error, so they can add up. And then you have the wrong blood pressure number, and you're not treating the right blood pressure number. So,
right. So it's so important to just make sure that you pay attention and do exactly like you said. Sit straight up with your back supported, feet flat on the floor. Yeah. And if you notice that you need a bigger cuff, please, now is not the time for vanity. I will tell you, I am the first. Before I lost the weight, I was very vain, and I would be the one on the plane that was not going to get the extension. I told everyone, I go, Lord, the plane gonna crash. The first thing they're gonna say is, I never seatbelt on, because I can't close. So I always would put my blanket over so you couldn't see it. But now this is not the time to be vain. If you need a bigger cuff, please tell them you need a bigger cuff. It should not squeeze you to the point that you're uncomfortable. Yes, it does get tight, but it shouldn't be to the point that you're very uncomfortable. That is not how blood pressures are taken, and you're not going to get a good reading. So yeah, all of that's very important. So can you explain the information that we get from the blood pressure?
So you're going to get usually three numbers. So you get the systolic blood pressure, that's the first number, and that's really the primary focus of everything we're doing. So lowering the systolic blood pressure is going to be more important than lowering the second number, the diastolic blood pressure. And that is because if you look at large studies that look at the association of blood pressure with bad outcomes, heart attacks and strokes and kidney failure, it seems like the first number is much closer tied to these bad outcomes. So as long as you can get the first number under 130, you're already pretty much there. It's already much better. And then you usually get a third number, which is your heart rate, your pulse rate. And, that should also probably be within 60 to 90 or so for normal net reading.
So it's systolic over your diastolic, and then they give you your heart rate as well. So what exactly, when we say blood pressure, what is this measuring?
So it's really measuring the pressure buildup that is happening in your arteries when your heart squeezes. So the first reading is the pressure that your heart generates and pushing forward the blood in your arteries. The second number is all the arteries that are actually a little bit elastic, sort of recoiling and going from a inflated balloon back to a relaxed tube. That second pressure is created by that recoil. And again, the first number way more important.
Yeah, so I did blood pressure readings one Sunday after church at a church on the south side of Chicago, which actually is in the community, the neighborhood that I guess has the number one deaths from strokes
Oh God.
in the country, not even in the state of Illinois. Blew me away. But I literally saw blood pressures 200 over 100. Can you explain to people why is that such a startling thing to see and why I should have been sending people to ambulances?
Yeah, so it's really important. So there's a linear relationship between blood pressure and the risk of bad things happening. And stroke is always the thing that everybody's worried the most with. So the higher the blood pressure goes, the higher the risk that any of these bad things will happen. And it's also important to know that even if you lower the blood pressure only by 5-10 millimeters, it's important to come below 130 if possible, but even lowering the blood pressure a little bit would translate to a tremendous reduction in risk. So every little piece counts. Every little lowering of blood pressure is a success. So you should be encouraged by that and not just say, I will never reach 130. I just don't take my blood pressure pills at all, because every little bit counts. So obviously, better to be at control, but every little bit really counts.
I had several people, unfortunately, that day who just stopped taking their medicine because they couldn't afford it or they couldn't get it for whatever reason. And so this is why it is so important that you take your blood pressure medication.
Yeah, and there's many options that are really very well tolerated, and you can cash buy them for $5 a month, a lot of those medications. So there's good options out there now. So cost hopefully is really only an excuse for a small proportion. You just have to make sure your doctor prescribes the right medications that are affordable and don't cost a lot.
Yeah, so that's a conversation. Talk to your doctor. Like you said, tolerable. If you are not tolerating medication, it makes you nauseated, causes you headaches, whatever sign, symptom, whatever. Please don't just stop taking it. Talk to the doctor. Most doctors, you can go through the portal online, so you can send them a message. Call the office and leave a message. There's so many medicines on the market now. They can make a change. But when you just stop taking medicine cold turkey, needless to say, I tell everyone there's a few organs that you just really cannot function without: your heart and your brain. You've got to keep your heart pumping, and you need to keep your brain, the blood needs to keep flowing through there too. So you got to be able to breathe too. Because I have asthma, so I was like, you got to have your lungs as well. But these are some vital organs, so you cannot play with your blood pressure medication. Just because you think this little itty bitty pill, that little itty bitty pill could be saving your life, and you just don't know it. But when you don't take it, your body knows it. So please, please, please don't just.
Yeah, and all these organs are connected. One influences the other, and blood pressure is really important for all of them. So.
Yeah. So, you don't want to upset your doctor, because one of the things that will upset them more than anything is, oh, I haven't taken that in 4 months when you show up for your appointment.
No. What happens?
Right. So, please take your medication. Don't miss your appointments if you can, please. Especially now, telehealth seems to be extremely popular after the pandemic. So you might not even have to go to the office. I know that there are several programs. My parents are part of one where they can take their blood pressure on a monitor, and the doctor immediately has the results. And if something is wrong, she has a nurse that calls. And so there are all sorts of amazing programs like that are covered by Medicare and Medicaid.
Yeah.
So you just have to ask the questions because your doctor only has so much time to see you. So they can't remember everything. So please,
that's right.
If you have your questions written down on your phone or on paper, ask the questions when you get there. I'm telling you, you will make their job a lot easier, and you'll feel a lot better when you leave, because you'll know that you got all of your questions answered. So now, can we talk about exactly what can we do to lower blood pressure outside of medication?
Yeah, so pills is always the easy fix, right? But what comes first is just being a good citizen and doing all the things right that can also actually lower your blood pressure. So obviously diet is super important. So take it easy on the salt. In the United States, we're all eating way too much salt. And if you're not controlling how much salt you put in your food, you already know that you're eating too much. So if you eat out, you know it's full of salt. It's really hard to find low sodium options in restaurants. High potassium is underappreciated. So eating vegetables that are really high in potassium also lower blood pressure. It's something that isn't really stressed, but that's really come to light over the past few years. It's a really important lifestyle intervention. Maintaining a healthy weight, obviously, that's important. It's easier said than done. But if you combine that with a little bit of exercise, you will see actually after you work out, your blood pressure all of a sudden, right after the exercise, maybe 10, 20 points lower. And then slowly it will go back up. But that just shows you how important exercise is for maintaining good blood pressure. So those are just a few examples. There's more things, avoiding medications or over-the-counter stuff that can increase your blood pressure. Too much
Some of our
Advil,
natural supplements can
some
increase
of
your blood
the
pressure, right?
supplements, check with your doctor, make sure they're safe and healthy for you. Too much Advil, bad for your kidneys, bad for your blood pressure. Don't take it. And then there's some medications that actually doctors will give you, and they can also raise blood pressure. And that's oral contraceptive pills, um, ADHD drugs, other stimulants, weight loss drugs. You have to be a little bit careful with those.
Yeah, so I when I lost weight originally, I that was earlier in the pandemic, and I had gotten new life insurance, and so they came to do the assessment, and she took my blood pressure, and it was like 90/60 or something. She goes, "Are you okay?" I go, "I'm fine. It's just because I work out a little more than the average person. That's all."
Yeah, yeah.
My
Congratulations.
was 110/60, 70.
Yeah.
So then I lost weight and then the exercise and it just came down. And
Amazing.
so,
Without
yeah,
medications. So if your blood pressure is that low without medications, actually a good thing, as long as you're not getting lightheaded or
nope,
dizzy, stand up.
not at
But
all.
low blood pressure, your body will like low blood pressure for sure.
Yeah. And so, and honestly, blood pressure is something in our family. So I'm very happy that one, I've never had to take blood pressure medicine, and two, that it stays at this level that it stays at because Lord knows, especially in the pandemic, I'm a full time caregiver now. And so I have lived a very stressful life because life is really different. But between exercise and water is my best friend.
Stay hydrated. Absolutely. 2 liters, half a gallon. It's a great goal. And you just feel better, I think. You kind of wash out all the toxins and
Exactly.
you just feel better and fresher. Absolutely.
And ladies, I'm telling you, my makeup artist was like, "What is it? What is it?" Because I'm honest, I was like, half the time, if she does my makeup, I might not wash it off that night. So she goes, "You sleep in makeup," but it's the water.
That's right. You get plump, right? You don't look dehydrated. It's
Exactly. I don't need Botox or anything. The water.
yeah,
And no one ever believes I'm 47. The water.
amazing.
So,
Amazing.
ladies, please, I'm telling you, the water has many benefits. Please drink your water. Now, many people, I'm sure that watching this are familiar with the DASH diet. If they're familiar, they've heard of it and ignored it, or they're on it. So, can you tell us again what DASH stands for? Because I always forget. But explain why the DASH diet is always given to people with hypertension.
Yeah, so the DASH diet actually goes back quite a bit now, I think over 30 years or so. But it's been the first study, a randomized trial actually, that looked at a certain dietary intervention and to see if blood pressure actually improves from that. And the biggest component of the DASH diet is the sodium, the S. So going from a high sodium level to a low sodium level with the DASH diet, which has other things in it too, can lower blood pressure by as much as 14 to 18 millimeters. That's really a lot. That's almost like 1 to 2 blood pressure medications that you can, if you're a really heavy salt eater and you could go to a low salt diet, that really is extremely effective. And then there's other things like high fiber in your diet, which is so important, not only for your blood pressure, but especially for your cholesterol. You can really wash your gut out with a lot of fiber, and you will see your cholesterol will improve. So they have, obviously, you can do that with beans and vegetables and celery and just things that are very high in fiber. But there's also some good supplements now where you can just take a drink with a good fiber content, and you will see amazing results for your cholesterol, especially. So the DASH diet is sort of a mix of a lot of different interventions, both food-wise, but the biggest component is really the salt in it. So you can adhere to that, but there's many other ways where how you
Yeah.
can lower blood pressure with dietary interventions. Focus on fiber, focus on sodium and potassium. I think that makes it pretty easy, I think.
And he threw cholesterol in there. Cholesterol is important, you guys, because the cholesterol will line your arteries, which will cause the blockage, which will cause you to have high blood pressure because the blood can't get through. So that's why it's so important for us to keep our cholesterol down. Now, I actually use, and I've talked about this before, no salt, and
Yeah.
it's actually potassium. I did not know potassium until you said it today, that it was such a great thing, because people would come over and be like, I don't want to use that. Give me regular salt. But I was like, okay. But I have used no salt. Oh my God, it's been more than 10 years.
It's wonderful. And put so high potassium then in your diet, which is perfect. It replaces the sodium. The only thing is if you're on certain medications that raise potassium levels, you have to be a little bit careful with the potassium chloride as a supplement. But for
Gotcha.
most people, especially if you're not on certain medications that raise potassium levels, or if you have chronic kidney disease, it's totally safe. And there just recently came a large study out that showed that just using salt supplements lower blood pressure tremendously in a large population. So it's really a great way to get around the salt issue.
And people seem to think that when we say, lower your salt, no salt, that they're not going to be able to, the food's not going to taste good. But that is so not true. There are so many, like you said, there are salt supplements like Mrs. Dash, and that's been on the market forever. But there's so many that you can put on your food, and just regular seasonings. People don't play with seasonings, and that cabinet that has all those jars that you've never opened.
Exactly.
Start taking them on your food. You'd be amazed.
Yeah, I mean, people don't want to eat boring foods, but
No,
salt is not the only thing to make food interesting. There's a lot of other things. Yeah.
yeah. So definitely make sure that you want to enjoy your food. You do not have to add salt to enjoy it. And really, honestly, too much will ruin it. So
That's
try
right.
some other seasonings, and
Yeah.
you'll see that and just like I said, my little no salt, I put it on my green beans, spinach. I mean, anything that you would shake salt on, I would put it on, and
Yeah. Yeah.
I like
Good.
it. It
It's
tastes
good.
fine. Yeah.
Yeah. Yeah.
So,
Absolutely.
but so if somebody, because there are people that have no signs at all, but people who are having signs of high blood pressure, what would those signs be?
Yeah, so that's the big bummer that they call it the silent killer for a reason, right? So you may walk around with a blood pressure of 160, 170, and may barely, if at all, feel it. So some people report they might get some headaches, they might get a little bit of a blurry vision when the blood pressure is really spiking and very high. But some patients have absolutely no symptoms. So that's why it's so important, as we mentioned, to check in on your blood pressure at least once a month. Make sure you're not on the wrong trajectory and walking around with uncontrolled blood pressure. But yeah, very, very few symptoms really. That's the problem.
And then there's the widowmaker. That's one of the heart diseases as well, right?
The widowmakers, yeah, so you have three coronary arteries, one that goes right in the front of the heart and supplies most of the blood and oxygen to your heart muscle. And when that artery, the left main coronary artery, occludes, that's the widowmaker, because at least back in the days, it would just kill people left and right. Now we have interventions. We have not only preventative measures like great blood pressure medications, cholesterol medications, and just know a little bit more about what's a good lifestyle. But now we can also actually fix these blockages and save lives acutely or long term if they're sort of slowly getting worse and worse.
So if somebody has high blood pressure, they're more than likely not in good shape in the first place. What is your first go-to? outside of changing their, like their diet and lifestyle, what about exercise? Like, how do they go about that?
Yeah, so the first step is always the hardest, right? So just to start some type of program, and by no means is it required they have to start running or start doing 5Ks or anything like that. Just walking is wonderful. I walk every day for about an hour. It just clears my mind. You have a break in your day. When you can. Sometimes I can't. And I'm trying to reach 10,000 steps. There's some studies that show maybe 6,000 is even more optimal, but at least getting over 5,000 steps a day by simply walking is just tremendous. You will feel so much better. And then you can add some weights just to increase your stamina, make sure your gait is strong, make sure you're stable. That also decreases the chance of you falling and getting injured and so forth. So it has a lot of other benefits aside from blood pressure. It really makes you healthier and more, steady and less likely to get injured overall.
Well, is there any last tip that you would give to people so that they can hopefully avoid having to go to the ER or urgent care because of chest pain or something, thinking they may be having some sort of cardiac event?
I think it's really important that you're just your own advocate. Don't stick your head in the sand and ignore a problem when it's there. Just be honest with yourself and say, okay, I have high blood pressure. It's not a death sentence. There's really good options and ways to fix that. And if you're very concerned about taking medications and you think like, oh, the pharmaceutical companies are all there to get me, there's really, really good options now that are extremely safe, very well tolerated, essentially give you no side effects. So talk to your doctor, be honest with yourself, and be your own advocate. And sometimes the doctors are a little bit lazy themselves. They don't want to start medications despite seeing a high blood pressure. They find excuses not to give you medication. So again, be your own advocate and demand that your blood pressure is being normalized. That is just so important.
Thank you so much for joining us today and giving us all this great information about hypertension in our hearts.
My absolute pleasure.